Hi everyone, welcome to the last micro lecture of the semester on food, on the future of food and health. In this short presentation, we're going to be looking at evidence-based interventions that have been used throughout the social ecological model. But before doing that, I wanted to end the semester with actually where we began and examining the leading causes of death in the United States. We know that costly chronic diet-related diseases are among the leading causes of death in the United States. For example, heart disease, some cancers, stroke, diabetes. But even though we know that that diet-related diseases are among the leading causes of death in the United States, we also know that to improve population health, there's a number of strategies out there and interventions that are already being used to help improve the diet of the population. And in doing such, we can bring about healthier populations and healthier ecosystems. So before looking at some specific case studies, in the text this week, there are a number of theoretical underpinnings when designing and thinking about successful dietary change interventions. And one of the most commonly used ones in trying to think about intervention strategies in public health is the behavioral health model, or the health belief model, which is an explanatory model for why people do or do not participate in prevention behaviors. So here, I wanted to just quickly give you a visual of what this health belief model looks like. So we have demographic characters and psychological characteristics influencing, for example, beliefs about chances of getting a condition, or the severity of an illness, its consequences, beliefs about the monetary and cost considerations that would be associated with taking actions. So before implementing an intervention, a lot of research needs to go into thinking about what dietary intervention is actually going to fit theoretically with the population that is being worked with to make sure that there's a successful and sustainable intervention that is put in place. So I just wanted to give you a quick kind of visual of one of the theoretical underpinnings that's offered in the text this week, and that is the health belief model that's mentioned several times. So then let's talk about some examples. Now, throughout the semester, we have talked about a number of really great examples, really great initiatives and programs that are aimed at bringing about healthier diets and healthier populations. This is, as you know, the social ecological model, and so I wanted to just kind of point out a couple of examples that at each level that were given from the text. So the first one at the individual level is the New Leaf program, and this was originated in Arizona, and this uses lay health advisors to do dietary risk assessments and evaluations that offer tailored feedback and goal setting and follow-up and reinforcements, and has offered as an evidence-based intervention, has really had some success in having dietary changes of the participants that have been involved in that project. The next one is WeightWise, and this is an interpersonal dietary change intervention case study and example. And so this uses group sessions with motivational interviewing and empowers the participants via self-exploration and social support to make healthy dietary changes. Now, the CDC has a blurb on this initiative and explains that it's a 16-week weight loss program and was originally intended for lower income, kind of midlife women in southern regions. And the pilot program focused on changing lifestyle behaviors to motivate, to promote weight loss among women with a BMI of about 25 to 45. And participants learned to set achievement goals, increase confidence, solve problems, and build social support. And there was also a session leader that was involved in the groups, but these groups were really not about information giving and more about trying to guide the participants in this self-discovery in terms of goal setting and encouraging lifestyle participation, so lifestyle change. So really encouraging the participants and empower the participants to come up with solutions in terms of dietary change, and then offering support within the group. I think it's important to also note that in the text it talks about this dose response effect, and this has really to do with the strength of the effect being linked to the level of exposure. So in this example, this would have to do with the number of meetings or the number of sessions was correlated to the outcome of the participants in that case study. Next, this is just a review because we've talked about this a few times, but at the organizational level, there's clearly a lot of evidence to suggest that farm to school and farm to institutions have a great impact on the number of fruit and vegetables that people are eating, and particularly among children and families. So really increasing the number of farm to school programs and the farm to school institutions, I think is showing very clear evidence to be a helpful intervention to bring about healthier diets in the population. And then lastly, this last initiative is Shape Up Somerville, which is in Massachusetts, and this is a community level intervention. This was a partnership among the local government, and academia, schools, healthcare providers, and businesses to really partner to improve the lives of children. And in this example, from this case study, this is an ongoing intervention. There was a great push to remove processed foods from schools, to eliminate high-calorie, high-fat foods from fundraisers, increase nutrition education, menu labeling in restaurants. And I think one of the really interesting and important things to highlight from this case study is that it's an example of community-based participatory research. And this is a model that, again, really empowers the community members and the stakeholders to participate and actively create an intervention that will work for that population. And so in public health, participatory research is a really important aspect of coming up with interventions, instead of having groups that are not necessarily tied to a community coming up with interventions. So I think this is a really nice example of a case study to highlight, because of the community-based participation as a model is so important. So that's just a really quick snapshot of the varying levels along the social ecological model where interventions can come in. And as I've said before, we know that interventions are needed at every single level, and to have this holistic and collaborative approach in public health to mitigate the undesirable outcomes that are coming from very costly diet-related diseases, and having an unhealthy food system and unhealthy populations and unhealthy environments. So the good news is that there are a lot of really, really inspiring interventions out there. And as public health professionals, we need to advocate for these good interventions at every single level. That's it. Thanks so much.